Good morning and welcome to the WellMed Charitable Foundation Caregiver Teleconnection Series. Today we have our dear Lucy, who's presenting on what you need to know about medications, the benefits and risks for seniors and caregivers. Let me tell you a little bit about Lucy. Lucy received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-term manager of the Caregiver Support Center and a respite family program for family caregivers, where she oversaw multidisciplinary training across caregiving, mental health, elder abuse, and palliative care. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association for her dedication in developing a national coalition to support caregivers. She's also co-edited a book for healthcare professionals called Responding Creatively to the Needs of Caregivers. Lucy has been a key architect of screening and assessment tools for professionals across North America. She consults for private industry, including WellMed Charitable Foundation and clinics in Texas. Additionally, she's the liaison supervisor at the School of Social Work at McGill University. So she has absolutely nothing to do but to be here on these conference calls for us and to do all the research she does so well. Thank you so much for being here, Lucy.
Thank you so much, Evelyn, and thank you, Minerva. Good morning, everybody, and welcome. So as Evelyn said, we're going to be talking today about medications, but I would also like to tell you that after the session is over, we are going to close the recording, and I will remain on the line for an informal discussion or question period for anybody who wants to remain. So what I also want to tell you is today I will be introducing a guide called Understanding Medication Safety, Taking Important Steps to Protect You and Your Loved One. And it's by the WellMed Charitable Foundation. It's free of charge and it's available. And Evelyn will let you know at the end of the session how you can actually get that free guide. So we revised the guide in 2019, and I was the one who edited. And it's really an amazing guide. It's a very worthwhile thing to have. Now, let me tell you a little bit about the guide. Most of the information that I'm sharing with you today regarding the safe use of medication is in the guide. It's a very good tool to have on hand. A lot of questions that you may have or experience are in the guide, with corresponding answers to your questions. But remember, it's only a guide that will give you some answers as well as guidance to report any issues to doctors or pharmacists. No matter what, if you have concerns about any form of medication that was prescribed or you're using, speak to the pharmacist or the doctor as soon as possible. Next slide, please. Okay, so today the topics that I'm going to cover is what are medications and possible side effects, medication and the risks of falls for seniors, common mistakes when using medications, pharmacists are your best friend, examples from the guide. Okay, so what I do want to say is medications is somewhat a double-edged sword. Modern medicine has contributed to longer lifespans, improved health, and better quality of life. Medication are the most common treatment for many diseases and conditions seen in older people and persons with disability. Medicines now not only treat and cure diseases that were untreatable just a few years ago, they aid in the early diagnosis of disease, prevent life-threatening illnesses, relieve pain and suffering, and allow people with terminal illness to live more comfortably during their last days. However, for adults, older adults, and people with disabilities, medications, prescription or over-the-counter, social drugs such as alcohol, herbal medications, can be a double-edged sword. When not used appropriately, effectively, and safely, medications can have devastating consequences. You know, the changes that occur with aging and disabilities make people more likely to suffer medication-related problems, what we call MRPs. Nevertheless, research has shown that medicine-related problems are often preventable. Caregivers can play a key role in helping to identify when an actual or potential MRP is occurring. This assistance can help prevent the costly and unwanted negative consequences of medication use, such as admissions to acute care hospitals, assisted living facilities, or nursing home. About 1/4 of all nursing home admissions are due, at least in part, to the inability to take medications properly. So, it's really a reality check. I also want to share with you that, that the safe and responsible use of medicine is important for everyone, but is of particular concern to seniors. Seniors take more medication than any other segment of the population. Okay, so American seniors, they take approximately, there's about 16% of the population are seniors. They receive between 28 to 40% of all medications prescribed. And believe it or not, some seniors take as much as 9 different pills per day. Because of an increase in the incidence of chronic or acute illness with age, older adults are more likely to suffer from conditions that need drug treatments. At the same time, the physiological changes that accompany aging increases seniors' sensitivity to medication. It affects the way older adults absorb, metabolize, and eliminate medications. Many seniors are also taking several kinds of prescription and non-prescription medicine at the same time. As a result, they are more exposed to the risk of adverse reactions from unnecessary or inappropriate treatment and the misuse of medicine. One study showed older adults had an average of 3 drug-related problems. So in reality, many caregivers may find themselves helping with administrating or arranging multiple drug therapies, filling and picking up prescriptions, and monitoring schedules. Caregivers often see the results of any side effect and must act accordingly. What I mean by that, if you see anything really happening, you should call the doctor and the pharmacist as soon as possible. Now, medicine misuse causes at least 1 death every day in the country and injures roughly 1.3 million every year. According to the U.S. Food and Drug Administration, people aged 65 and older are especially vulnerable to medical errors for different reasons. Caregivers play a vital role in keeping seniors healthy by familiarizing yourself with the most common medication errors. Now, there's another study that I also looked up, and I was trying to find more recent, but this is kind of the recent study, was according to the CDC Center for Disease Control and Prevention. It was done in November 2020. Older adults, 65 years or older, visit emergency departments almost 450,000 times each year, more than twice as often as younger persons. Older adults are nearly 7 times more likely than younger persons to be hospitalized after an emergency visit, but most of these hospitalizations are due to just a few drugs that should be monitored carefully to prevent problems. There is a lot of others, but these are the ones to keep in mind. Blood pressure, diabetes medication, seizure medication, opioids are some of the examples. So what they're actually saying is that we need to keep in mind that medicine, either prescribed or over the counter, has the potential to improve health and well-being. Many people, including older adults, depend on medicine to provide relief, control the medical condition, and help them lead normal, active, or independent lives. But when not taken properly, it can sometimes cause other health-related problems. So that's why we're doing this session today, so that you can have a really good understanding. And I know that a lot of people are very, you go to your pharmacist, you ask questions, but I think it's so important to keep in mind that how these medications can really affect someone, especially someone who has dementia. So I want to talk about a little bit about the fact that so many people are taking different medications for different reasons. Older adults have multiple medical conditions sometimes. These may affect how medications work in the body. Medicines used to treat one condition may also make another condition worse. For example, older adults with memory problems may have worsening symptoms caused by the medicine used to treat their other condition. So if they have, for example, cognitive impairment, but they also have high blood pressure or maybe diabetes, one interacts and reacts with the other. It is so important that all providers who prescribe medications for you or the person you're caring for, you need to tell them about all the conditions that you or they have. Also, be sure to let healthcare providers know if a medication that was prescribed is actually giving some side effects. And we're going to talk about these side effects. But, food and beverages also has an impact. So it can, medication may be affected by food and supplements or medicine that you take at the same time. For example, some antibiotics are not absorbed well when taken with foods, beverages, or medicine that contain calcium, magnesium, or iron, such as antacids, vitamins, or dairy products. Certain fruits, such as grapefruit juice, can also change the metabolism of certain medication. This may cause the medicine to build up in the body. You can ask your pharmacist about what foods, beverages, or supplements to avoid when you pick up your medication. So it's so very important to always look at the sheet. You get a sheet with every prescription about what the side effects are, how often you should take them. And please always talk to the pharmacist when you get a new medication, just to make sure that you're aware of everything. So let's go to slide 3, please. Now, I know we all know what medications are, but this is just a little bit of a reminder, because sometimes we forget that we know that prescription medication, obviously, over-the-counter medication also. Sometimes people don't realize that if you have a prescription, let's say you have a cold, you want to go and get something for a cold, it's very important to keep in mind that it can have adverse reaction. Even natural products or herbal things, vitamins or organic products as well. So if we look at what is medicine, we know that it comes in tablets, could be capsules, pills, liquid, puffers, inhalers, even creams, patches, drops, needles, suppositories, and ointments. So all of these are considered medication. Next, please. I do want to speak about side effects. It's really, really important to look at that. So they're also called adverse reaction to drugs that can be a symptom that develops due to taking the medication. So some people really, really feel extremely dizzy, which can cause falling. Now, believe it or not, mental confusion, especially those that have any form of dementia, that could increase. But even if you don't have dementia, some medications could cause you to do if you're at a certain age. Dehydration is huge. And we know that when someone is dehydrated, they can get more confused. Their personality changes. There's diarrhea. There could be constipation, even rapid heartbeat. People say sometimes that they're sweating, like they're wet. They don't understand why. Pain that was never there before. And then if there is aggressive behavior, both physically, could be verbally, boost sex drive. You have to take this into consideration. So if you see that, please call the pharmacist as soon as possible, because some side effects can go away. Some are expected. There should be on the sheet, which will tell you that it could cause dizziness. And others really are just found when they do medical tests in the labs that tells them exactly what's going on. So if you think someone is having a bad reaction, call the pharmacist or go to the hospital if it really gets worse. Now, we said that it was an interactive session today. So before I go any further, if anybody has any questions about what are medications or side effects, you can ask me now.
If you don't mind, Lucy, I'm just going to go back to Ann Cook's chat. And we've had that question before about providing closed captioning. And I think we kind of hit a brick wall. Minerva, do you want to weigh in on that one?
I don't understand what you're saying.
I'm not sure what was discussed with the closed captioning. I did write it down to discuss it later.
Okay, cool. And we will check into it. I believe we've done it once before, but hopefully we'll be able to get some movement this time for you. Sorry. Okay, Lucy, I'm sorry. Go ahead.
No, that's good. I'm glad you answered that question. It's important. Okay, Anne, so that's good. Does anyone have any questions about side effects? It's important, very important, because sometimes we don't even realize it. We just take it for granted. Something is happening with this person. Maybe they're getting more confused, but it could really be the medication that they're on. All right, so if anybody needs a question, raise your hand, or you can put it in the chat or think about it. We can talk about it a little bit later as well. Okay, so let's go on. I do want to also say that certain medications can also boost someone's sex drive or cause aggressive behavior, especially for someone suffering from dementia. And I did talk a little bit about it. But please remember that if a loved one all of a sudden starts behaving inappropriately sexually or in any other way, it's time to call the doctor. Explain to the doctor what's happening. Many caregivers tell me that they're embarrassed, especially if it's a sexual thing, to discuss the problem with anyone. Please keep in mind that the behavior may be caused by certain medications or other physical problems that the person has, for example, that you're not aware of. They could have an infection of some sort. And the doctor needs to know. As well, the doctor may want to prescribe a new medication to calm the person down or reduce a medication that they are on. So by all means, always, really, if you see a change, anyone who has any cognitive impairment, and even those who don't have severe, as I said before, dehydration can really cause that capacity to become more confused and more disoriented. So can we go to slide 5, please? Thank you. Now, I know that I mentioned this, but I really want to go over this a little bit more. As we get older, our bodies react to drugs differently than when we were younger. It's interesting, but the aging process can affect how the medication is absorbed in the body, and it takes longer to flush it out of our body. Change that decreases your body's ability to break down or remove certain medications from your system may mean that the medication can stay in your body longer, which it accumulates, and that's not what we want to happen. So some studies have shown that certain medications are less safe for older adults, and we're going to definitely talk a little bit more about that. But before we do, I do. Can you just go to slide 6, please? Okay. So there's the Beers criteria. The American Geriatric Society recommends Beers criteria that list medication that may not be safe for older people. Okay, so there's a link there. This criteria can be used as a tool when talking to doctors and pharmacists about the safe use of medication for seniors. It was updated in 2019. So this is a really good resource to have, and I think I've used it myself when I was caring for my mother. You can check all the medications on it, which will give you a clue onto some of the side effects that can happen. And if you notice that the person you're caring for or yourself, that these side effects are happening, you should call your doctor and pharmacist, because possibly they can change it with less, because every medication has side effects. So I'm just wondering if anybody wants to ask questions about this particular criteria, or if you want to add some more information about it.
We have a message from Charlene. She
Yeah.
said, yesterday I attended a session where they talked about vascular dementia. My mother often experiences dizziness. How do I know if it's because she has vascular dementia or if it is because of her medication?
That's a great question to ask. I think was your mother diagnosed? Who was she diagnosed by?
She was diagnosed by a neurologist, but I don't know what type of dementia. I'm just stepping in as her caretaker right now.
Well, sometimes it's really hard to diagnose and to have the real symptoms, but so you're concerned that maybe it's the medications that's making her behave a certain way, is that it?
That, or if she hasn't been properly diagnosed with her dementia, I'm not sure.
Have you spoken to the doctor about that?
I tried. They said they're busy and we have to wait till December because it's a new symptom and they want to wait to talk about it.
That is the most frustrating thing in the world, in our healthcare system, I have to say. Here you are being anxious about your mom, trying to do all the right things, and you're kind of caught because really, I certainly cannot answer that for you, but you're right on. You really need to know, but sometimes it's very hard with certain things, even with Alzheimer's to, I mean, there are different tests that can be done and certain blood work that can be done. But you are, at least you're going back to the doctor, and I think it's important to have all your questions that you need to answer. Now, was she prescribed certain medications that she's on right now, and you've noticed the change?
I think she's always been on these medications. The only one that I think was new is I think it's the memantine, where they increased the dosage. That's the only other thing I can think of.
Have you spoken to her pharmacist at all?
No, I wrote that down, that's the next best option for now to hold me over until December.
And I'll tell you, I'm going to talk about pharmacists. I have to tell you, they're one of the easiest healthcare providers to get in touch with, and one of the most knowledgeable ones when it comes to medication, and especially with people with dementia. So I hope that you're using the same pharmacist for all her medications so that at least they know what they're dealing with at that point. We'll talk a little bit more about that, but I think that you're set. I think that you're doing all the right things that you're doing to try and get this resolved, and hopefully you will by December. But thank you for that question. It's such an important one.
Anybody else? If you're on the phone, press *6 and I can see that you've opened your line. Otherwise, you can unmute yourself. Go to the chat room, put your hand up.
Was there another chat that I maybe thought I saw or not?
I don't think so.
Okay. All right, so let's go to the next slide, please.
Oh, yes. Ellen wanted to know if the slides will be available. And yes, Lucy sends the slides out with the post-session questionnaire, or they get sent out with the post-session questionnaire. Sorry, Minerva. Minerva does the work.
Absolutely, you can have all the slides because I think it's so important. That's why I love the guide, because everything I'm talking about is in the guide. And believe it or not, all the questions that you may have might even be answered for you in the guide. I'll show you how it works a little bit later. So that's really, I think it's a wonderful tool to have. Okay, so let's look at following routine and finishing medications. It's interesting because unfortunately, sometimes I hear from caregivers that, well, I'm feeling better, so I'm going to cut, I'm going to stop the medication. Medication is so expensive. It's either I put food on the table or I buy my medication, which is so sad to hear because it's so important to finish all medicine or sickness could occur again, especially antibiotics. I've been on antibiotics myself, and usually around the second or third day, you start to really feel like almost the symptoms are gone, but they're not. It's still in there. And so especially antibiotics need to be finished and taken properly, not saved for a later date. Probiotics are so important to take when you are on antibiotics because it does affect your digestive system. And for women or possibly even men, there could be yeast infections. So it's so important to speak to your pharmacist if you are taking any antibiotics, what you should be doing, what you should be eating. Remember, I told you, Grapefruit juice is not great to take when you're on antibiotics. So what foods you're allowed and what you should be really taking care of. So, some medication and medication needs to be taken at certain times of the day. So even in the guide, it tells you, okay, I forgot, we're only human. You can forget to take a medication. But the guide will tell you most of the times, if you forgot to take it, don't panic and don't just take it right away. Call the pharmacist. The pharmacist will say to you, will tell you, take it now or wait till your next dose. Don't worry about it. It's going to be okay. And what is also important, which I'm sure all of you are very aware of, that there should always be a list of all medications in your possession and the home. If something happens, let's say, the ambulance needs to come, it needs to be shown, or maybe you can't respond at that time. Or if you're out and an emergency happens, it's also very important to have all your medications and conditions, whether you write them on a piece of paper or have it in your phone. Most people can put it on their phone, etc. I do want to open it a little bit to any questions that you may have about following routine. And I also want to say that there are organizations, if you cannot afford buying your medication, or you're trying to sort of save them for another day, there are organizations that could possibly help you financially with that. And maybe at the end, a little bit, Evelyn can talk a little bit about that. So thank you. Any questions?
So folks, this is your opportunity to talk to dear Lucy. Please just open up your phone by pressing *6 or open up your Zoom. I'd love to hear.
Thank you, Evelyn. Okay, we have time to think about it. And don't forget, if any of you want to stay on after the session is over, I'll be around for another half hour. Glad to speak at that point. Before we go to our next slide, which I don't want you to put it up just yet, my question is, do you know where is a safe storage to put your medication? I'd love to hear from you. Where do you think is a safe place to keep your medication?
Hey, I've got my website open, folks. Tell us what you think. Pillbox.
Pillbox, good one. What else? Want to hear another one? Thank you, Ellen. Anybody else? Like physically, where should you be storing your medication physically? Okay, so let's go to slide 8 and let's have a look at it. Do not store medicine in the bathroom or the kitchen because they can be affected by dampness and heat. So it's logical to think, let me put it in the bathroom, right? There's a medicine cabinet. That's a big no-no. Because, you put on the shower, you're running the hot water, it could affect the dampness, and the heat can affect the medication. You really have to be careful. Do not store medicine in any place too warm, like near a stove, heater, or in the sun. So if you need to take your medication, if you're going to the beach, be very cautious that it's not, reflecting down, and the sun is not reflecting on them. So the best place to store your medicine is in a cool, dark, dry, and secure place, such as the bedroom. Note that some medication has to be kept in the refrigerator, obviously. So you will do that if that's the need. And really try to minimize the number of times that the bottles or vials are open to reduce exposure to moisture. Weekly pill remind boxes can help. So thank you. That was a good one. Try to keep all medicine together for convenience, okay? Because people sometimes take so many medications, it just can be very confusing. And I think a pill box is so helpful, or some of them are wrapped individually daily with all the medications that you need to take. And obviously keep medicine away from children or from pets. So if there's any comments regarding safe storage of medication, now is the time to ask, or maybe add something.
Okay, we have one from Ellen. Let's see. Are there any pills that cannot touch others, such as in a pill box, and would need to stay in the bottle?
That's an excellent question, but not to my knowledge. And that's a question that needs to be asked to the pharmacist as well. But it's a very good question. I never thought about that. So thank you for that. I will talk a little bit about later on about not cutting pills. So if you are cutting your pills and putting with others, there might be something there needs to be looked into. But we'll go over that in a little while. I do want to talk about the risk of falls, drugs, and the risk of falls for seniors. Okay. There was a study done in March of 2021 by the University of Buffalo, and they found that 94% of older adults prescribed drugs that raised the risk of falling. Remember, we talked about the fact that you really need to understand what medications and what are the risks that the person has been prescribed. The study found that the percentage of adults 65 and older who were prescribed a fall risk, a prescription drug, climbed to 94% in 2017, a significant leap from 57% in 1999. Okay, so obviously new prescriptions are coming up, new medications are coming up every year, maybe every month. And so it's really important to make sure to really understand if that medication has a risk factor for being dizzy or falling. So because seniors take more medication than the younger population, and I'll repeat it again because I said it only in the beginning, 28 to 40% of all medicines prescribed are for adults, and the risk for side effects are tremendous, especially the more pills that you take. So obviously, when you get a prescription, you have to go ask your doctor, and the pharmacist will know a lot better than even the doctor whether this medication that has been prescribed has a higher risk of dizziness and making people actually fall. So people who suffer from any form of dementia and are taking prescription medication or over-the-counter medication, remember about that, are higher level of risk for falling. So what do I mean by over-the-counter? Like sometimes people can't sleep. There's so many sleeping pills available at the drugstore. You don't need a prescription. You have to be really, really careful with that because that could make them dizzy. And remember, as I said, accumulation of medication in the system, and maybe they have a prescription, you're giving them over the counter, it hasn't gone out of the system, it accumulates, they wake up dizzy, they wake up really feeling not well. I know that you know what dementia is, but very quickly, I just wanted to review it. It's a syndrome, usually of chronic or progressive nature, in which there is the deterioration in cognitive functioning. Example, the ability to process thought. It affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Consciousness is not affected. But just naming all these things, you could just imagine how impaired that person could be. So if they are displaying any signs of having side effects like dizziness, the chances are that they don't have the cognitive ability to use good judgment in navigating in the home or outside. So what do I mean by that? So they might feel dizzy, but they want to get out of the chair and they don't have the judgment to even realize that they might fall. So they get up and possibly they fall because they're dizzy. So that whole cognitive part is so important to keep in mind, that even if you tell them don't get up or why did you get up, you have to be patient. They're not even aware of what they're possibly doing and what a risk it is to themselves. So let's go to slide 9. So according to the US Centers for Disease Control and Prevention, more than 1 out of 4 Americans over 65 falls each year. falls are the leading cause of fatal and non-fatal injuries among older adults. And this is quite a recent study. It was done in March of 2022. And, we know that, older people, they fall, there's all kinds of fractures. About 36 million falls are reported among older adults each year, resulting in more than 32,000 deaths. Each year, about 3 million older adults are treated in emergency departments for a fall injury. 1 out of every 5 falls causes an injury, such as a broken bone or a head injury. Each year, at least 30,000 older people are hospitalized for hip fractures. More than 95% of hip fractures are caused by falling, usually by falling sideways. Women fall more than men and account for 3/4 of all hip fractures. So that's a big concern. So on top of that, just being elderly puts you at a risk for falling for different reasons, which I will describe a little bit later. But at the same time, if you're taking medications, well, that's a pretty good high percentage that you really have to keep in mind. So if we can go to slide 10, that would be helpful. So let's look at some of the medications' risk of falling. So any drug that causes falling can increase the risk of falling, okay? That causes the following. So again, we're looking at dizziness, we're looking at drowsiness, we're looking at people who have hypertension, high blood pressure.
Is that hyper or hypo? Hypotension is low, that's low blood pressure.
Low blood pressure. Oh, well, thank you for that. Parkinson's, shaking, poor mobility, gait disturbance, poor muscle control that causes, clumsy, involuntary movements are at a high risk. Vision disturbance, not seeing well, double vision, macular degeneration, which is a symptom that a lot of elderly have, especially if they're not wearing the glasses. So any drugs that causes the falling can increase the risk of serious outcomes if an individual falls. Obviously, osteoporosis reduces bone mineral density and increases risk of fractures if fall occurs. Obviously, bleeding risk, increased risk of hemorrhaging if there is a fall.
So Lucy, if I may,
Yes.
the reason I brought up the hypotension issue is because I've been in so many people's homes and they talk about how it's hard to get out of bed in the morning and they feel a little dizzy. And usually it's because of low blood pressure. And the only thing they need to do is just sit on the edge of the bed for a minute and let their blood circulate, throughout their body. And then they'll be fine to get up and won't be dizzy.
Thank you so much for that. You're right. All right, so let's go to slide 11, please. So this is a little test that you can do for yourself. And since you're going to have the slides, you don't have to write these down or remember. Have you or your loved one had a slip, trip, near fall, or fall in the last 6 months? I don't mean like, we all slip, but it's conscious, like it really happened. It was something that it's occurring a little bit more. Are you or your loved one taking a drug that can cause side effects of such as dizziness, difficult walking, etc.? So again, it's very important for you to check with the pharmacist to know if that drug may affect that. Are you or your loved one taking a high dose of drugs, which can also cause that the sense of dizziness and could make you fall? Are you or your loved one over the age of 65? If yes, patients may be more sensitive, as I said to you before, about using drugs and having too many prescriptions. Are you or your loved one taking more than one drug? That increases the risk for sure. Are you or your loved one at high risk of falling for other non-drug reasons? Poor mobility, using a cane or a walker, or having certain diseases that makes you frailer, as we talked before about Parkinson's? Is it difficult for you or your doctor to monitor for adverse drug effects? I mean, that sometimes is really difficult. They just don't know quite why there's that dizziness, as somebody was asking. Does your loved one suffer from any form of dementia? Okay, so these are the risk factors for sure. Now, before we go to our next slide, I really want to focus on, just looking at the time over, good. I always say that pharmacists are your best friends. You know, pharmacists play a role as part of the interdisciplinary health team for an older adult. Their role is crucial in improving the patient's care and quality of life. You know, for older adults, it can be helpful to develop a relationship with a pharmacist and use the same pharmacist regularly. As pharmacists learn about an individual's unique needs and circumstances, they can help provide consistent care and help prevent drug-related problems. Pharmacists are often the most accessible healthcare practitioner. They can give patients drug information, monitor use, and act as liaison between physician and patient. Additionally, they can provide information on interaction, as we talked about drugs and what's going on. You know, again, the average adult over 65 takes, this is really high, but that's part of the research, between 14 and 18 different prescription medications each year, okay? Changing around. The pharmacists can educate older adults and caregivers on how this medication can help. So, so it's the thing that I really want to point out, it's really important to use one pharmacist. So let's go to the next slide.
Lucy, can I add a few things to your list of things that put you at risk?
Sure.
Just from experience, 50 years doing social work in people's homes. One of the things is dogs. You know, a lot of people have gotten dogs, especially during COVID. They take their dog out. The leash gets wrapped around their leg. They fall down. They break their hand or their arm or their elbow or their leg. And it's, I personally know at least 10 people have done that with, you know, because they're, you know, some of the dogs are pretty big and it doesn't really matter if they're big. If it's a sudden start, you know, or something.
Yes, absolutely. That's a very good point.
Another one is grandkids' toys. You know, if you're used to having a clean home and nothing on the floor and you're walking around and not paying attention, a lot of people trip over the stuff that's left in the middle of the floor. So that's an important one. The other one people don't realize is that if you're taking any kind of thing for osteoporosis or osteoarthritis, any pain, analgesic medication, it often has huge amounts of aspirin in it. And when you take over-the-counter stuff with it, they often have huge amounts of aspirin in it. So again, you know, you're so right. Don't take anything over the counter until you talk to that pharmacist.
For sure. Thank you for that. So let's look at, you know, pharmacist tailored care, and we talked about it. You know, they supply physical accessibility to them. I mean, they're very accessible. Having drug labels and written material in large type, some caregivers really say that it's too small. They can make it larger. They can make it even in the person's language, if possible. You know, they can cut pills if they're too large to swallow. Never cut the pills yourself. Please don't do that, because we don't know if the effect would be the same once it's cut. And unless you have been trained to cut it, I don't know, sometimes you could cut it too large or too small. And as I said, it's important to use one pharmacist. All right, let's go to the next slide, please. Okay, now I'm going to talk about the guide very quickly as I'm looking at the time. So once you get the guide, this is the contents of the guide. It's got general information. It looks and it talks about any problems taking medication. So there's questions, and then there's tips, any problems with the mind and body, meaning how they're behaving, any other problems with medications, any changes with medications questions, person taking the medication, how are they reacting, medical chart. There's a nice medical chart, questions for the doctor or pharmacist when you go to see them, and contact information. Next slide, please. Okay, so this is what it looks like. I tried to copy it. Obviously, it's a little bit longer because the guide is a nice size. So a question could be, is the prescription medicine for more than one pharmacy? You could say yes, you could say no, or you could say, I don't know. Does the person have any medicine samples from doctors? So let's say if you say yes to number 2, as you could see, if yes, talk to the pharmacist before the person tries them. That means just because the doctor gave it to you, and it's a sample, don't automatically take it. To make sure that the sample go well with other medicines the person is taking, sample packages are a good way to test a medicine and find out if it will work for that person. Next slide. Okay, so it could be, has the person had any changes? Okay, and their appearance, their skin, their complexion, their eyes, their hair, their appetite. Are they eating more? They don't want to eat. They feel sick to the stomach. They have dry mouth, is more, they're more thirsty. If yes to any of these questions, describe the specific change and tell the doctor and pharmacist right away. So, for example, the skin, your skin can change. You can become very pale. So obviously something is going on with your complexion. Eyes tell us a lot about what's going on. Bloodshot eyes, nails, circulation, hair falling out. So this is really, it goes into much more detail. I just took certain segments just to give you an example. The next slide, please. Now, it could be, has the person had any changes in comfort, meaning any pains, aches, headaches? So you could say yes, no, or I don't know. Has the person had changes in energy, more tired or more energy for that matter? Has the person had any changes in sleep? They can't stay awake or they're falling asleep. So if we go to the next slide, hopefully that'll give us our answers. Well, in the slide before that, it will give you, if you said yes, it will tell you what you need to do. Now, thank you for that. So if they have pain. Now, the other one, does the person drink beer, wine, or liquor while taking medication? This is a huge one. I mean, there are people who, they're certainly not alcoholics, but they do drink. Maybe a glass of wine at meals in the evenings or occasionally. And it's really important to make sure. So it says, if yes, make sure it's okay to have alcohol while taking the medicine. Check the medicine instructions, label, and ask the pharmacist or doctor to make sure. If it's not okay, the person will have to stop drinking alcohol or drink less while on the medication. Explain that alcohol can make side effects worse or make the medication not work. Alcohol and medicine do not mix well. Alcohol interacts with many kinds of medicine, often reducing their effectiveness and causing many side effects like impaired coordination, stomach inflammation, nausea, and vomiting. This may happen even if it's a long time between a dose and a drink. So this is kind of an example of what the guide actually looks at. I'm just wondering if there are any questions about the guide and what I'm saying at this point.
I have my little website open, folks, so if you have questions, let me know. Looks like a great guide.
It is a great guide. All right, and I'd love every one of you to have it, and you can have it free of charge. Let's go to the next one, 18. Now, here we go. So there's another segment. It has the person medicine changed lately in the last 2 or 3 weeks? And if you say yes, be especially careful to watch for any problems or new developments. Review the questions in the guide every few months. So this guide is not, it's just a continuing, it's like a little go-to when you need it. Has the person been in hospital lately in the last 2 to 3 weeks? And if you say yes, be especially careful to watch for any problems or new developments, because usually when you're discharged from the hospital, they usually change your medications and sometimes they keep it. And so here you are taking this person back home with some new medications. Obviously, you need to tell the pharmacist as soon as possible, even if they gave you some medications in the hospital to carry you through a couple of days. and really be very conscious about what's going on. Let's go to the next one, please. So here's another example from the guide, questions for the doctor, pharmacist, or specialist for every medicine asked. I mean, I know it's really important because, you know, you go to the doctor's office and you're thinking of all the questions and you don't have it written down. And then you walk out a little bit later and you say, oh my gosh, why didn't I forgot to ask this? So it's important to ask the name of the medicine. I mean, there's some generic ones and ones that could be a little bit less expensive. You want to know why, what it does, what are the expectations of this medication? If you have Parkinson's, is it going to reduce the shaking a little bit more? If it's diabetes, what are the intention? Obviously, how to take it, when to take it. These are all important questions which the pharmacist will answer. How long to take it? Are there any special storage conditions? Are there possible side effects? What to do if a dose is missed? All these things are in the guide. Should the medicine be taken with meals? How to tell if it's working? Are there any special containers or packaging needing? How to dispose or throw away old medicine? Please do not throw them in the garbage or flush them down the toilet. That's really very, very bad for our environment, and it's kind of dangerous to do that. So if you, and if a medication is expired, please don't use it, or call the pharmacist to ask, give them the date and say, okay, the expiry date is this and this. Many times they'll say, it's okay, you could still use it for about 3 to 4 weeks or a month more. Or, so pick them up, put them in a bag and bring them to the pharmacy when you can. Are there any pamphlets or other information to read later about this condition? So the guide goes into really, really specific areas. And so what I also want to talk about a little bit is if someone is being discharged from the hospital, please make sure that you have a discharge plan for that person, meaning that everything is written down, when there should be a follow-up, the medications that need to be taken, what are things that need to be done, if there's a dressing, should a nurse be doing that, should you be going to a clinic, very specific, so that when you do come home, you're not kind of lost and you don't know what's in store for you. So if we can go to the next slide, please. So here are some references, which I always like you to have, that you can go on and get a little bit more information. And I'm looking at the time and it's almost to the top of the hour. So if anybody has any questions right now, I'd be happy to answer them. Otherwise, Evelyn will let you know what other things are happening. And then remember that if you want to stay on, we'll take a little break and I will stay on just to talk about maybe more personal things.
Anybody have a question or a statement or an answer to something that we need to know? We'd love to hear from you.
Or a little tip that you have.
Yes. Okay, I'm going to do my little tap dance here, Lucy.
Sure.
Think about it. We have, we're going to send out a post-session questionnaire in the next couple of days. You will receive Lucy's slides, and I want you to know that you will also be able to sign up in response to get that guide for free from WellMed, and you'll need to sign up when you get the post-session questionnaire. It will come with the resources and the references here. I also want you to know that if you have not signed up, if you haven't registered for this, that you'll need to register, because only those people who are registered get the post-session questionnaire and the resources. And if you want to register because you've got the number from somebody else, you need to call 866-390-6491. That's 866-390-6491. You'll also get the incredible monthly calendar. We still have 7 or 8 different presentations, very interesting this month. I did want to give you one resource And I will include it with the post-session questionnaire. And actually, it's 2 resources. If you feel like you have to make a choice between your food and your medication, there are programs to help you. Medicare Extra Savings is one of those. Medicaid, you might be eligible for Medicaid with the share of cost. There's also, if you got your Medicare and You handbook that the government sends out every year, on the back cover is the number of the SHIP program in your area, or how to get a hold of the SHIP program and find out where it is in your area. SHIP stands for State Health Insurance Program, and it's money that's put in by managed care plans so that you can get advice about, how to pick the right medical plans, how to get the extra savings plans. So be sure and use that information on the back of the back cover of your Medicare and You. And the other thing I want to tell you about is that it is National Caregiver Month, and they're having WellMed in joint with many other people, many other health associations are having this Friday, the 2023 Caregiver Summit called Finding Balance in Your Journey. It's online and in person. You can sign up for it. It will be virtual and in person. And that one is Friday. That's one's in English. And then next Thursday, there's also one that will be totally in Spanish. And the presenters are, pretty famous people who I think you'll find very interesting. And let's see, I think that's it. I'd like to thank everybody who's been on the line today. Very interesting conversation. Lucy, you did a great job. Thank you for all your research and stats and, tips. I know that folks on the phone really appreciated it, and I know I did. And I want to thank all the caregivers for what you do every day, pretty much all day, I'm sure. And I want to thank the WellMed Charitable Foundation, for all of the things that they do for caregivers, the caregiver teleconnection, the SOS centers, the clinics, the conference, the aging summit, which I think is going to be spectacular. And for really helping support caregivers so much, both in through these podcasts, through these sessions, with their website, and also, in their clinics, just, thank you so much to WellMed. And we hope that we will see you all again very soon. Get that monthly calendar out and pick up some more things that you're interested in and get registered. So with that, I'm going to log off, and Lucy will stay with you, and we'll log off, and you can always she'll tell you how to be anonymous, excuse me, in the phone call. Bye.